Welcome to the Joint Commission Center for Transforming Healthcare Preventing Falls Targeted Solutions Tool demo. The Preventing Falls Targeted Solutions were created by 7 leading hospitals and healthcare systems which work closely with the center's team to tackle falls prevention using systematic process improvement methods to identify the targeted solutions. The work from these original 7 hospitals is shared to all our healthcare organizations through a web-based application called the Targeted Solutions Tool, or TST, that is free of charge, confidential, and separate from accreditation. The TST is an application that guides healthcare organizations through a step-by-step process following the DMAIC approach of Lean Six Sigma to accurately measure their organization's actual performance, identify their barriers to excellent performance, and direct them to proven solutions that are customized to address each organization's particular barriers. The TST provides the foundation and framework of an improvement method that, if implemented well, will reduce your organization's falls and falls with injury rates. The Preventing Falls project can be completed within 8 to 12 months, and that should be your organization's goal. Let's take a tour of the Preventing Falls Targeted Solutions tool. The first thing you'll see as you're entering the Preventing Falls TST is the Projects page. Under the My Project tab, you will see all the projects listed for your organization to which you have access. If this is the first time that you are entering the tool to begin a project, you will click on the New Project button to get started. Once you start creating your projects, then the page will populate. You will have information about each project by name, and you'll have the ability to go directly into the fall event measurement tool, the charts for analysis, and the ability to export data for each individual project that you have access to. If you have set a project up by mistake, you have the ability to delete it so that project will not be aggregated with other results. Under the Dashboard tab, you'll get a quick look at your preventing fall efforts at an aggregate level for all the projects you have set up. As you can see, in our example here, we have 2 projects that have been set up. The dashboard provides an aggregate for your falls and fall with injury rates for the baseline and improved periods of all your projects, depending if you have data entered for those projects in those particular time periods. Once more organizations have used the Preventing Falls TST, a benchmark rate will also be displayed for falls and falls with injury so you can compare your rates with the rates of other organizations using the TST. Also, as an aggregate, you'll be able to see some detailed analysis of all your projects that includes your top 5 contributing factors, your falls by primary cause, falls by injury level, and finally falls by location. The dashboard is updated in real time as more data is entered into the TST. So now we'll go into one of the projects so you're able to see the structure of the tool from start to finish. Click on the My Project tab. We will select and click on one of the projects. So we'll select the Falls Demo project. As you can see, the tool is laid out following the DMAIC approach of Lean Six Sigma. We have the Define step, the Measure step, the Analyze step, the Improve step, and finally the Control step. You can get to any step by hovering over the tab and then selecting a specific section that you want to go to. So for example, here we'll click and we'll be on 1.1, which is the overview. You can also get to each step and section in the navigation, which is found on the left-hand side. The tabs and sections are in order of progression. We'll start with the Define step, move through Measure, Analyze, and then finally into Improve, Control. Within each step, you'll see the sections that you'll follow. From 1.1, which is the overview, all the way through reviewing your project parameters, finally to 1.5 to build your team. You will see this progression in each of the sections for each step. When you first start a project, the TST will take you to the first step of the tool, which is the Define step, into the first section, the Define Overview section. This section focuses on laying the groundwork for a successful project and listing the key activities for this section, including naming your project, reviewing the project parameters, reviewing and completing project tools, and building your team. You will also find the operational definitions for falls and injury level classifications based on the NDNQI definition in the required reading section. Required readings can be found for each step that should be read prior to moving forward in that particular step. There are also additional readings here in the Define step that include information about the TST and the methodology behind it, the business case for this project, and the project timeline and resources needed that can be used to gain leadership commitment and support for the project. This is key not only for project success, but also for sustainability. In the Name Your Project section is where you would name your project. Once you've named your project by entering the name of the project, select a name that is easily identifiable by any team member or data collector that you give access for data entry, and this is a free text field. Then select the category that best describes your area, unit, or setting, and you can select from the drop-down menu. And then optional, you can also enter the number of beds for your selected area or unit. And then finally, click on the Save button. Once you've done that, then your project will appear on that My Projects page that we talked about earlier, as well as on each of the steps and sections within the tool to make it easier for the project lead as well as the data collectors and those data entry folks to identify the project and enter the data in the appropriate project. So here you can see Falls Demo Project was how we named this project. Please read the Scoping Guidelines document prior to selecting your unit or areas. The expectation is to collect data for all falls for your project for at least 3 months before starting the Analyze phase. The goal is to collect a minimum of 20 to 30 patient falls in that time period. If necessary, because your falls or fall with injury rates are low, your project can be scoped to include multiple units. A broader project scope can allow you to reach the goal of 20 to 30 falls in that 3-month time frame. If your fall rate does not allow you to meet the goal of 20 to 30 falls in the 3-month time frame, you can still use the tool by collecting all the falls that occur in your organization during the 3-month period. This will allow you to identify all the contributing factors and implement the targeted solutions for those contributing factors that need to be addressed in order to reach the goal of 0 with falls and or fall with injury. Also make sure that if you include multiple areas or units for your project, that your patient days are calculated the same for all those areas and units. Once you've named your project, you'll then move on to the Project Parameters section. In the Project Parameters section is where you'll find the parameters for the project, what is included and excluded. The project includes only patients 18 years of age and older on the identified project unit, and this project is mostly for inpatient units. Another parameter is for data collection requirements, including the use of operational definitions, and ensuring data collection will continue throughout the project. If you will not be working within these parameters, you can still use the tool, and we would love to work with you as a pilot using this tool in another setting or for another population. Please contact us at the web address, tst_support@cth.org. Before you move to the next section, you'll have to select the yes or no button depending on if you'll be following the parameters for this project. As mentioned earlier, we'll be collecting the data in the aggregate to develop a benchmark for falls and falls with injury rates, so in the future organizations can compare themselves to other organizations that have used the TST. And we want to make sure we are comparing apples to apples, so if you're not going to follow the project parameters, please click on no, so the data that you'll be entering will not be aggregated as part of the benchmark. In the Project Tools section is where you'll find tools to help you gain acceptance and buy-in from leadership and staff. This includes team building, which details the expectations and time commitment of the team, the project charter, which details the formally agreed upon project scope, goals, and timeline, and finally the stakeholder analysis, which helps to identify the project stakeholders, their support for the project, where you need them to be in terms of support, and an action plan to bridge the gap between the support you need from them and where they currently are. Once you've completed these tools, you can move to the final section of the defined step, Build Your Team. In the Build Your Team section is where you're able to give team members access to the Preventing Falls project. Depending on how you want to set up data entry, you can give access to all your data collectors and they can enter their information directly into the tool if they are near a computer, laptop, or are carrying an iPad. Otherwise, they can collect the data manually via paper-based form, and you can have one person designated to enter the data by only giving them access to the TST. So how would you give access to team members and data collectors? You would enter the individual's first name, their last name, their email address, and then select the role. And for them, you'd select the role of team member. Finally, you'd click on the invitation that will be sent to that individual and will provide them information on how to access the Preventing Falls Targeted Solutions tool. They will receive an email with login instructions. You as a project lead can track their access by looking at the member status column. Once they have logged in, you'll see that member status change from pending to active. If they have not received the email or if they've deleted the email by mistake, you can actually resend the invitation. If team members leave anytime during the project, you can delete them out of the system as well as editing any information you have entered. This completes the defined step. Once you've completed each of these sections, you can move to the measure step. In the measure step, current performance will be measured and contributing factors for falls will be collected. The measure overview section focuses on gathering as much relevant information as possible on the current process in order to fully understand both how it works and how well it works. Key activities for this section include training your data collectors and adding fall events data, including patient days for falls and fall with injury, so the system will automatically calculate the rates for you. Enter your baseline start date prior to collecting data, and this will let the system know that the data you are going to collect from this point on will be for your baseline period. Before you move forward in the step, read the required readings. Once you've completed all this, you'll move on to training your data collectors. In the training data collectors section, there are downloadable training materials, including a training video, a data collection guide, a written exam, and a test answer key. The test answer key is only seen by the project lead. The video scenarios take approximately about 10 minutes and should be viewed by the data collectors prior to taking the exam. At the end of the training session, there is a brief exam that data collectors will take to ensure that the data collection process is accurate and consistent. The data collectors are expected to score 90% or better on the exam before they can be sent out to collect data. Once training has been completed, the data collectors are ready to collect baseline measurement. You, as the project lead, have the ability in this section to track your data collection training and whether or not a data collector has passed the exam. And you can do this by entering their name as well as indicating if they passed the exam or not, and then clicking on Add. And then you'll start to get a drop-down list of all your data collectors and whether or not they have passed the exam. If your data collectors did not pass with a 90% or better, re-educate them and then retest them. Once they have achieved a 90% or better, they can then go out to collect your baseline measurement, and you can go back in the tracker here and then edit, and then click on yes, they passed the test. In the Enter Historical Data section, historical falls data is entered for the time period. We recommend about 6 months prior to the start of your project. If you would like to see how previous fall rates compare to the rates entered during this project, you do this by entering the month and the year, the number of falls with injury, and the patient days. The TST will automatically calculate then your rates, both for falls as well as for falls with injury. Anytime you've made an error, you want to delete a row, you have that ability within the tool to do so. And finally, of note, if the definition of the fall outlined in the define phase was not followed when counting the number of falls and fall with injuries during the months prior to the start of the project, they may not be valuable to compare rates because you'd be comparing unlike items, which leads to an inaccurate comparison. So again, you want to make sure that you're comparing apples to apples, especially when you start to look at your data for analysis. In the Add Fall Event section, data is entered by the data collector on each fall event. Data can be entered into the TST in one of two ways. The data collectors can get access to the tool and enter their observations directly within the TST using this online form, or they can collect data using the paper-based form, which is downloadable, and then giving that form to a designated data entry person who will then go directly into the tool using this online form to enter the observations. There is skip logic embedded in the online form, so certain sections will expand and have follow-up questions based on the information entered on the previous question. Data collectors will enter responses to the questions asked on the data collection form, and once this has been completed, click on the Save button, and then the analysis can be retrieved under the Analyze tab, which we will talk about in a few moments. Under the Modify Fall Event section, modifications and or updates can be made on the previous fall events as new information is discovered. For example, at the time of the fall, it was marked that the patient had no injury, but later, after further testing was done, an injury was discovered. You as the project lead or the data entry person can go back into the tool under this section to make those modifications. Find the fall event, and then you can actually then go directly into the event to make any corrections, and then just click on Save. Again, everything in the TST is real time, so once you've hit the Save button, it'll automatically recalculate, and all the analysis will be up to date. The final section in the measure step is the enter patient days. So you'll enter the patient days for each month in order for the Targeted Solutions tool then to calculate your monthly rates for both falls and falls with injury. So you'll just enter the month and the year and the number of patient days. Again, you'll have the ability to edit or delete if an error occurred. And please remember, only enter patient days for the areas or units involved in the project. And once your baseline data collection period has ended, so again, you've now collected for that 3-month time frame, you can then move to the Analyze step. In the Analyze step, baseline performance and contributing factors for fall events are identified. The Analyze Overview section focuses on interpreting and understanding the data that's been collected, especially the contributing factors that are leading to your falls. Analysis is about discovery. And the discovery is key to implementing the best solutions to have the greatest impact overall. So again, having the greatest breakthrough improvements for your project. Key activities for this section include viewing your baseline results, sharing the findings with leadership, your team, and also with staff. And then finally, continuing to add fall event data, including your patient days for falls and falls with injury rate calculations. Again, don't forget to read the required readings before proceeding in this particular step. In the results summary section, you'll be able to get your real-time results based on the entered fall event. You'll be able to see a summary of your baseline rates for both falls with injury and for falls. You'll also get a list of the top 5 contributing factors for your falls, as well as your falls with injury. You'll also see further breakdown of your falls by primary cause, your falls by injury level, as well as your falls by location. And again, everything in the Targeted Solutions tool is in real time. So again, if you're going to look at your data at a later period, anything that's been collected up to that point will be in the analysis that you see here. If you want to take a deeper dive to look at your data, you can go under the View Charts section. There are different chart options for analysis. What you see here is the run chart, which displays your historical and baseline falls rate, as well as helping to indicate if there's any variation or trends in your process. You also have a pie chart, and this will break down the number of contributing factors from highest frequency to lowest frequency for all events that occurred in the baseline period. You'll also see charts for falls by primary cause, by injury level, and also location. The default here is for falls, and on the left-hand side here, you have the ability to cut your data further. So if you want to look at a particular month, you can do that. Once you put improved data in, you can compare your baseline to improve. And as I mentioned, falls is the default, but if you want to look at your contributing factors for falls with injury, you can do that as well. For the run chart, you have an added feature where not only do you see the rates, but you can actually see the actual counts. There's also chart help for each chart that explains the details of each chart, and page help located in the upper right-hand corner that provides additional information on how to interpret and understand each of the charts that's being displayed on the screen. So once you've done your analysis, you can move on to share the findings. And in this section, it's recommended to share your findings, again, of your baseline analysis, not just with leadership, but also with your team and staff, so everyone is aware of the progress of your project from your baseline performance to your contributing factors, letting those folks know what are your opportunities for improvement moving forward. Very similar to what you saw in the measure phase, the next 3 sections repeat, so continue to collect data and add your fall event. If you need to make any modifications, you can do so. And finally, enter your patient days. So now once your data has been analyzed for the baseline period, shared with leadership, your team, and your staff, you can now move on to the improved step. In the improved step, solutions are implemented for improvement. The Improve Overview section focuses on implementing solutions targeted to the key contributing factors that were discovered in the baseline period. So first, you want to identify the improved start date. The improved start date should reflect the month you start implementing solutions. This date will let the TST know that the data collected from this point on will be your improved data. Key activities for this section include implementing solutions, continuing to add fall events data, including patient days for falls and falls with injury, rate calculations. Again, this will help you to validate then that the solutions that you're implementing are actual improvements and not just changes. Again, read the required reading section before moving forward in this particular step. This will help you in successfully implementing solutions by addressing the human side of change. Now it's time to implement solutions. So in the Implement Solutions section, you'll find your core and targeted solutions. Once you've read through your core solutions, which includes the fall risk assessment tool, the handoff communications process, change management, and post-fall huddle solution guide, and you've implemented these core solutions, you can then move on to look at the solutions that are targeted specifically to the contributing factors that were identified. So very similar to what you saw on the pie chart, you'll see all your contributing factors from highest to lowest frequency. In our example here, bathroom assistance is the #1 contributing factor. So if you click on the View Solution, what you see pop up is a solution guide as well as an action plan. In the solution guide, you'll get an understanding of the problem, those contributing factors that led to the problem, the actual solutions, and then finally the action plan. What are going to be those next steps to implement the solution to address this particular contributing factor? The action plan step is a who, what, when, and follows those next steps that you saw in the solution guide, but at more of a detailed level. So you can assign responsibility for each of those steps to be implemented, the goal date for implementation, when was it completed, the cost, and any comments. Finally, enter the date the solution was actually implemented. This is an important step since it will populate the control plan, which we will talk about in the control step in a few minutes. So once you've implemented all your solutions, again, you're going to continue to collect data. So add your fall events. If you need to, you can modify them. Finally, enter your patient days. And then you can start to view your results. So the rest of the improve section are very similar to the sections in the analyze step. You'll be able to see your results summary as well as you're taking a deeper dive to view your charts. Except now what you're going to see is you're also going to see the improve period. So again, all the analysis is in real time, and you'll be able to validate now if the solutions we've implemented are real improvements and not just changes. So again, here in our example, you can see our rates both for falls with injury and falls has gone down. Again, you can take a deeper dive looking at the view charts. And the first things you'll notice that your chart will have two different colors. The white background represents your baseline. The greenish background represents your improve. And again, this helps to distinguish those two phases. Again, on the left side, you'll be able to further drill down if you want to look at particular months. Again, the default here is falls, so you can look at falls with injury. If you want to look at your counts, you can do the same thing also with your pie charts. Again, there is chart help for each chart that explains the details of each chart, and page help in the upper right-hand corner. And this will provide that additional information now on how to interpret and understand each of the charts for the baseline and improve period. Once you've completed and again shared your data analysis for the improve step with leadership, with your team, and with staff, you can now move into the control step. And this is the final step. In the control step, concepts and tools will be implemented to sustain the gains you've made. The control overview section focuses on embedding the solutions into your daily work to ensure that your improvement results are going to be sustained. So you want to start by entering your control start date, but only enter the date once you've completed the implementation of the solutions you've selected, including your core solutions, entered data in the improve phase for at least 3 months, and finally reached your target goal for falls rate and or falls with injury rate. The key activities for this section include implementing a control plan, ongoing data collection, by continuing to add fall event data, including your patient days for falls and falls with injury, viewing your control results, and then spreading your work to additional areas or units within your organization. Finally, again, read the required readings. This will go again into detail on how you can now sustain those improvements you've made. Once you've done that, you can move to the control plan section. Under the control plan section, there is a control plan template, which is a tool to document and plan the main activities that are needed to continue in order to sustain the gains of your project. Without a well-thought-out control plan, you run the risk of losing your hard-earned gains. The plan talks about roles. It also talks about the next steps that need to occur when something starts to trend negatively. You'll also have a data collection plan that includes the frequency of collecting data and who's going to be responsible for that. And this is really the transition from the project lead to the project owner. And moving forward, the project owner will use the control plan to be able to help sustain those improvements that have been validated for this project. Again, the control plan will be self-populated from the solutions that you've implemented in the improve step. So again, it's very important that you enter that start date of when you actually implemented each of those solutions, because once you've done that, that'll actually then populate your control plan. And then working with your team and the process owner, you'll identify how the solution can fail, the chance of this occurring, and how this can be prevented. Who's going to be responsible for it? Once the control plan has been completed, you can move on to the next section. And in the ongoing data collection section, this really describes the importance of continuing to collect fall event data. The need to collect data will not end as part of this project. Data will need to be collected to really sustain those improvements that you have made. So again, you saw as part of the control plan, the data collection piece. You will need to continue to monitor that process to ensure your results. And in fact, you might also see improvements, even greater improvements over time as those solutions start to become part of daily work. And again, why is it so important to continue to collect data? Well, how will you know if your process and improvements are not working if you don't collect data to actually monitor that process? The next three sections are very similar to what you've seen in Measure, Analyze, Improve. You can add your fall event data, you can modify it, as well as enter your patient days. And the process owner should be aware of those fall and fall with injury rates. So again, this has been outlined in your control plan. And if those numbers start to increase, the process owner should pull together the core team to find out what factors are contributing to that increase and how they can be addressed quickly. You'll also have the view chart section. This is where the process owner can see if the sustained rates are continuing. And then finally, the spread section focuses on next steps. Now that you know that the solutions you've implemented were successful, have shown improvement, you may want to spread that success. There's a benefit in having consistent processes within your organization. There may be contributing factors and solutions that were discovered in this project that can be applicable and applied across similar areas or units or even across the entire organization. The project leader should work with the executive sponsor and clinical champion to discuss and determine if these opportunities could be implemented across similar areas or units or across the organization. Questions to think about for the project lead if they're working with the executive sponsor and clinical champion is, are there other areas or units with similar culture and patient populations that could benefit from the solutions implemented in this project? And can some of the solutions be implemented across the organization for standardization? Now, if the solutions cannot be implemented across similar areas, units, or across the organization, are there other areas or units where falls and or falls with injury rates are high where you now want to tackle that problem as well? So this was a brief overview of the Preventing Falls TST. For more information, you can go to our website, www.centerfortransforminghealthcare.org. And thank you very much for your time today.